welcome all to another episode of Humans Beyond MBBS. This is an initiative which talks about doctors who left the straightforward path of clinical medicine and ventured into unknown territories. आज हमारे साथ हैं डॉक्टर हर्षित जैन MD, popularly known as Dr. HJ, and he's a prominent name in medico marketing and advertising across the globe. He's a perfect example of somebody who's an amalgamation of global experience, worked with the likes of Prasoon Joshi, and has raised many of his own ventures very, very successfully. He's known for his innovative, out-of-the-box thinking, and this time this has led him to find his own venture again by the name again related to the doctors. How do you call it? Docsary, right?
Okay.
Docare. Okay. So Dr. Harshit, welcome to our interaction. Thanks for taking out time for the young minds who want to idolize you, who want to be like you, right? And let's start with Docare itself. What is Docare? How did the idea got incepted? What is your present role in that?
So thanks Gaurav for inviting me in this. It was a much needed initiative. So starting with Docare, so we present ourselves as first global network of physician-only platforms for programmatic advertising. What it means is pharmaceutical brands had to go to individual websites to communicate to doctors, and it was highly inefficient and ineffective. We are creating a network aggregating all the platforms which doctors visit for their professional purposes, so that pharmaceutical brands can communicate to them on a singular platform. And lots more can be added, which can help in improving their effectiveness and efficiencies with the way they market to physicians.
So how this doc care is going to take care of docs?
So see, as docs, right, when we go to even an Elsevier or a Lancet, one thing which irritates me the most is when I see the ad of a car or a toothpaste brand there, right? When I am thinking about, अरे यार ये patient आया है, इसको ये complication है, what should I advise him, right? और वहाँ पे आ रहा है buy a BMW, right? Buy a Beamer. So that's what used to irritate me the most. While it never happened when I was on Facebook, right? So this is what we want to change. How can we make all the communication relevant and contextual using data?
So ये idea of making the Facebook of doctors, ये आया कहाँ से? How did this idea got generated?
So it's very interesting story how this was an amalgamation of a lot of ideas, and actually one of them was something related to Facebook as well. But I think long story short, when I was in India, I used to think this doesn't happen only in India, right? And you kind of live with that perception. But after working in several markets, 3 continents, you kind of realize, no, this is not a problem just for one market, but it's a universal problem. Thought something definitely can be done about it. And then when I started looking deeper and deeper into the problem, I realized it's not really a problem, it's more of a mental block, right? Which is what we are trying to solve.
Mm-hmm. So let's go back into your MBBS days. PMT दिया, UCMS पहुंचे, right? ये revolution कब शुरू हुआ? ये revelation कब शुरू हुआ कि नहीं यार patient management, clinical practice से ना different कुछ और करना? And how all this started?
So very interesting story. I think I was the most active persons in my college who used to say कि after finishing this, I have to go to US. Yeah. So I was the most active person, and I think I would have mobilized several of my colleagues कि let's go to US, let's go to US. And we worked really hard. In my second year of med school, I worked on mice for 2 years to do some research projects, to publish some really good papers, which can give me a lot of value addition when it is about entering into a good med school in US. And all of that happened. I was in Chicago, and then I realized, what am I doing? Right? I am working more like a computer. and I'm not using my brain. Everything is happening at a spinal level. So the thought was, do I want to save my neurons from disuse atrophy or not? Right? So I said, I want to save them. So then the decision was do something else. I didn't know what would I do, because being a doctor, you always think very vertically. What can you do? You have finished your MBBS. You can only do MD. You cannot do anything else. MD is done. Now either open your clinic or work in a hospital or do DM. Right? It is very, very vertical thinking. And if you think about it, we have been programmed to think so vertically. And I wanted to think laterally. So all of this happened, and then things happened in a way that I kept on getting one opportunities after the other and didn't had to go back to medical practice days.
So, how did the people who wanted to see the Dr. Harshit Jain reacted to this change? Right. I know in my case, when I told my father, who insists was a doctor, that after MBBS I wanted to do something else, maybe an MBA or MHA, his first response was, "पहले education पूरी करो," for which him was कि पहले MD करो. Right. After MD, when I again went back to him, he said, "Why don't you open up your hospital? Why you have to work for somebody else?" Right. So it was not an easy battle with my own father. What all did you face, and how did the world see you, as they say, wasting a medical seat?
Yeah. So went through the same and same experience. But I think the only benefit I had, when you're licensed to practice in two countries, right? I managed to convince my parents कि एक साल दे दो मेरे को. If I manage to prove myself, I will continue. Else I go back to medical practice. Right? That's the benefit of being a doctor. And they were happy that at least I have come back to India. Right? So that was their bonus.
You played the cards very well, right?
Yeah, and till date there is no looking back. And if I ask them, do they know what do I do? Does my wife know what do I do? No, she doesn't.
And yeah, quite interesting. Or उस समय, did you have anybody who could guide you, who could tell you exactly this is what you need to do? As you said, we have a very vertical thinking. डीएम की तैयारी करनी है तो उन लोगों के पास जाओ जो ऑलरेडी तैयारी कर रहे हैं या क्रैक कर चुके हैं, या किसी सीनियर प्रोफेसर के पास जाओ कि सर मुझे नेक्स्ट क्या करना चाहिए. बट व्हेन यू आर गोइंग ऑन अ टेरिटरी वेयर यू डोंट इवन नो वेयर यू आर गोइंग, was any hand holding available to you?
No hand holding was available. You had to define your own road, and till date have been doing the same. And being a doctor, you always have that advantage, right? I don't think it's like wasting a medical seat. Like, it opens up your mind to think rationally, to think analytically. I always consider MBBS like any other graduation. Think about it. When an engineer finishes his engineering and then goes to an MBA, people don't say he wasted an engineering seat, right? He should do engineering. Why is he going into business administration? It's completely different. He should have done a BBA, then go for an MBA, right? But it doesn't happen, because it is now an established thing that you do an MBA after engineering and you get a good job. But after MBBS, it is considered you wasted a medical seat and you are only made to serve people, don't charge money, get beaten by people, etc., etc.
Well, there is another take to it. Somebody once told me that rest every graduation is a single bachelor's, but you people do two bachelors, right? And you should be more careful about it. So that's a perspective. I believe the same. I was treating patients in ICUs, and once I ventured out, I think I was able to touch much more lives as you have done, right? And I think the whole essence of this conversation is that we never had any one person to hold on to say कि अब next क्या करना है. Maybe these conversations will quench the thoughts of many young medicos who are thinking I want to venture out, but they don't know how to do it, right? So that's I think one of the purpose which we want to serve by doing this. So you have been a very, very successful in your own venture. So could you tell us, after MBBS, USA, what all you have been doing till now?
So after story starts from US, when I decided I want to do something else, right? So I joined hands with an organization called Altruista Health. Right? I was the founding employee, and simple idea: how to improve health of the people using technology and big data. Right? We built a proprietary technology which can import data from health insurance plans, and then it would create opportunities, care opportunities for each and every individual based on a risk stratification. Like, for example, that if a patient with diabetes didn't get his HbA1c checkup done for last 6 months, it would show up as an improvement opportunity. That why hasn't he got an HbA1c checkup done? So a care nurse will call up that person actively to find a reason for deviation from health behavior, whether he doesn't have money, he forgot, or his last experience was painful, etc., etc. Right? And try to convince him for a proactive prevention. Right? He doesn't have anything, he is not experiencing any symptoms, but convincing him to for prevention proactively really helps in reducing the healthcare costs. So did well. Then I had to move back to India, then join hands with another startup in the healthcare communication space. I was fascinated by the role communication plays in changing behavior of people, and especially PR, how politicians have maximized the usage to change perception and behavior of people. I thought, why can't we use it in healthcare? Right? So ultimately sold both the companies, made some monies, then moved to advertising. I still don't know why I moved to advertising, but I did. And then I think I really enjoyed the advertising stint that I did. It was a 7-year stint. And so I was working with one of the large advertising groups in the world called McCann. And I was leading the India business as the MD. Then I moved to a Asia Pacific role leading China and Japan businesses. Then I decided to relocate to London to lead growth for the European business. And then I decided to relocate to New York to lead digital data and innovations business. So very exciting journey, 7 years, learned a lot, worked with majority of big pharma, did some amazing work, solved some big problems, and would have won all possible awards that exist in advertising till date, and really felt accomplished that I have done something, I have helped. Like being a doctor, you always feel that you are helping people, right? I always feel like when I'm not practicing, right, I am helping population at large. So from helping people, I'm able to address populations now. So worked a lot on solving vitamin D deficiency problem in India, helped in improving immunization compliance across the globe, helped in improving some diabetes education. So lots of stuff, lots of very exciting stuff.
Wow, 7 years and so many things. It seems ki you had 48 hours in 72 hours, in 24 hours, right? You were living to
Yeah,
maybe you had clones who were doing so many things, right?
yeah. Like if we look back, yes, like in last 2 years, I switched 2 countries with my family, and with a little one. Like my little one is now 4 years old, so his accent is now a fusion accent, a British American accent, and he talks Hindi in British American accent. So yeah, it was quite an adventure.
Lovely. So tell me, you spoke about data, you spoke about technology. हमारे कोर्सेज में कहीं भी ये पढ़ाते ही नहीं है मेडिकल कॉलेज में. यहाँ तक नहीं, ना तो कम्युनिकेशंस के बारे में पढ़ाते हैं, ना डेटा के बारे में पढ़ाते हैं, ना इस चीज के बारे में पढ़ाते हैं कि जो तुम्हारे प्रिस्क्रिप्शन पे लिख रहे हो इसको तुम प्रिस्क्रिप्शन के बियॉन्ड कैसे यूज कर पाओगे. So how, when you were also formed in that traditional stereotyped way, how did you get to all these ideas, and how you were able, did you feel any limitations while realizing your ideas?
No, I was. So I did a MBA, an executive MBA program from IIM Lucknow, but I don't think that would have helped a lot. I think on-the-job training helps a lot more. I was always fond of reading, so I used to read a lot about the category, about the industry, what is happening, future perspective. So a lot of articles I read every day. I think that really helped in shaping my thinking, and I was always keen in solving problems. So with that background that you get after reading, and if you want to solve problem, it helps. So I am more of a on-the-job learner than someone who believes in reading, going through the books.
And being a doctor, how did it help in your all ventures? What the basic education which you had, how did it help in your your ventures?
So people had to listen whatever I said.
It gave you that edge, right?
So I got undue advantage
Right.
being a physician. यार इसको तो आता होगा, आप सही बोल रहा होगा कुछ तो ये.
Yeah, I can very well relate to that. But you know, many medicos which I have seen, they always feel constrained कि हमें तो numbers समझ में नहीं आते हैं, हमें तो ये Excel समझ में नहीं आती हैं, ये तो जो इंजीनियर MBAs हैं, ये business plans बनाना तो उनका काम है. What is your advice for our young medicos that how they should bridge of being a medico where they can speak with confidence and still be the master of the things which any MBA can do?
Yeah. See, passing an MBBS exam, I think, is one of the most difficult things to do in life. And if you have done that, you can do anything in life. Right? Understanding an Excel or making a business plan is not even 1% of passing an MBBS final year MBBS exam. Right? It is very easy. So I think my only advice is stop thinking vertically. Right? Start thinking at least laterally. Right? There is a bigger world out there which people haven't explored, and where there is a great need for professionals like you. Right? So people in communication industry don't understand a lot about health, diseases, etc. So if you have that kind of an understanding, you understand what a patient goes through. There is a lot more you can contribute in this field than just treating them.
Right. So Harshit, now we have this new education policy coming in, right, after 34 years, which talks of vocational courses. It talks that in ninth onwards, you could choose amalgamation of subjects, which was very stereocast for us. That ये तो medical है, ये non-medical है, ये commerce है. But nobody is still talking of medical education, right? If given a chance, what do you think should be added to the medical education curriculum of this country so that we have more and more people adding value to more and more, I would say, doctors adding value to population rather than people?
Yeah, so it's a very controversial question, I must say. And see, our healthcare system needs a change, right? And I can see it changing after COVID-19 settles. It would be a completely different world. Right? I can see the total number of people who are becoming doctors every year is going down. Right? If I go back to my school, at our time there used to be 3 sections of people who used to take biology. Now they're not even able to fill one section. Right? So lesser number of people, and it is happening because of multiple reasons. Could be the social things that are happening, could be the cultural things that are happening, could be the financial things that are happening. So it's happening at multiple levels, which would need a change. It's not that people don't want to become doctors, but I think the world is now moving in that direction where people really don't want to become doctors because of these external influences. And that's when all the governments will wake up to see what has happened. And then it will be a lost opportunity. Right? So, couple of things. So, like I give this example. So, my wife, she's a pediatric hemonc. I've tried to convince her a lot of times that यार क्या रखा है डॉक्टरी में इतना टाइम खराब करते हो I'll give you so many other opportunities, maybe you want to try them. She said no, I don't want to, because I like treating patients, right? And I don't like money etc will follow. I don't care about that, but I won't leave medical practice, right? So it is people like her who have to kind of bear the torch of medical practice and enlighten the world.
Right,
I
right.
really admire people like Dr. Devi Shetty, right, who have been doing that really actively. I had the pleasure and privilege of working on few ideas, few campaigns with him, like Save the Doctor, where we wanted to equalize the MBBS and MD seats. Like, why make it so difficult for doctors who have passed MBBS and then they have to sit for 2 years just to get into an MD seat, right? It is the longest duration of education which a doctor has to go through, and you make it even worse, and especially in a country which has shortage of doctors.
Totally agreed. So again, another dilemma which these doctors have, that to make a change, do I really need to leave clinical practice? For example, I'll give you the traditional old system again, where our professor would become the dean and he will also become the medical superintendent, but still will do his surgeries, or we have examples like Dr. VK Paul now. He's member Health Niti Ayog, who's himself a neonatologist also, right? Or Dr. Randeep Guleria, who's the AIMS director, but still sees patients. So the dilemma is, should I divulge into everything else and still do clinical practice? Or do I leave my clinical practice and make a bigger impact? What is your view on this?
So leaving or not leaving is completely an individual's choice, right? As I said, it's just about lateral thinking. Keep yourself open to ideas and explore opportunities which come your way, right? So many doctors you named who are continuing to do medical practice, and they are able to explore lateral opportunities as well, in which they are doing so well. I know so many people who decided to leave medical practice, and they are doing so well in those lateral opportunities itself, right? So I think it's about follow your passion. Don't limit yourself that अब हमारी MBBS हो गई है तो हमारा जीवन खत्म, अब तो हमें MD ही करनी पड़ेगी.
I think one of the things which you said makes a lot of sense, that a doctor always remains a doctor. Even if you fail in your lateral thinking, you can come back to your practice anytime. At least you did whatever you wanted to do. So with that, Dr. Harshit, what is your message to people who are doing MBBS but want to think lateral, who have done MBBS but want to think lateral, who have done their MHAs, MBAs and are still struggling to think lateral? What is your message for all of them?
So my simple message for them would be, take a break for one day, right? And try to find out what you really want to do. Stop running after what you have been doing since last 5 to 10 years. Because being a doctor, I've seen you only run. You only run after other people. You have not taken a break even for a single day. Take a break, and the next day would be a completely different day for you.
Wow, very well said. Very well said. Thank you, Dr. Harshit. I keep on inspiring people. You have really tread territories like communication, like big data, advertising, and now docare, where I have not seen anybody else doing so many things in such a short span of time. I wish you all the best in the coming times. May you rise more. May you take this flag more higher and become an icon for many people who want to migrate you. Thank you so much for your time.
Thank you. Thank you, Dr. Gaurav. Really nice meeting you again.